Hello, this is Kim McAllister, and we're going to move on to Health Education Part 2, where we talk about the various education theories. First, we're going to talk about social learning theory, and this is the theory that people's behaviors are based on outcomes, what they expect to get from the experience. So, a patient may be in the position of, I don't want to do something painful like self-inject insulin or do a finger stick blood sugar test because that hurts and it's not making my diabetes get better. So some of what we do is assessing and asking patients what their expectation is or what their expected outcome is from the educational experience. And when you do that, you're using social learning theory. So then you want to frame your information in a way that meets their need. So an example of that would be, if I poke my finger and my blood glucose is high, then I can take my medication and that will make me feel better. So because the patient now has the expectation that poking their finger will make them feel better, then they're more willing to monitor their blood glucose themselves. Behavior theory is based on the fact that behavior in what people do is programmed by stimulus and response, much like Pavlov and his dog. You may remember with Pavlov, he was giving the dog food and ringing a bell at the same time. And eventually the Pavlov would just ring the bell and the dog would begin to salivate and act as though food was present. So this is where you use positive reinforcement to get someone to do something. So for a child with type 1 diabetes, it might be, if you check your blood glucose, I'll let you watch an extra hour of TV today. So for the patient, you want to find out what is a motivating factor for them and get them to utilize whatever that is. And you want to try to avoid things like food or things that could adversely affect their health. So find something that they want to do and something that they're willing to use as a reward and utilize that. With a cognitive theory, you're looking at how patients think, feel, and learn. And so this is you're maximizing their ability to carry out these functions. So this takes things a step further in that if I learn how to take care of my diabetes and I get my blood glucose over control, I can participate on the tennis team and do other things that I want to do. So it's looking at a broader view. And so with this, we're looking at what's important, what goes on inside their head and how they think and how they feel. This is something that we use a lot in education and counseling, and we're looking at what is their goals and expectations. Those goals and expectations become the motivator, not some type of reward. The humanistic learning theory focuses on the whole person, the person as a whole. It has a humanistic view. People are more than just wanting to do things or having expectations. All of the beliefs and emotions are what make a whole person. And so we're trying to develop all of them and meet all of their needs, not just get them healthy, but get them fulfilled and give them a sense of well-being, a sense of accomplishment, a sense of purpose, pulling all of those things in together to help the patient learn and become all they can. And so an example of this would be, if you check your blood glucose regularly, you'll be less likely to have those hypoglycemic episodes that made you feel bad and then you had to drop out of your clinical class and then you couldn't achieve your goal of becoming a nurse. So when we do all of these things and you're healthy enough to go to class and attend clinical and become what you want to be. So it's more of a global and holistic approach to the patient. And this is something that involves knowing more about the patient and spending more time with them, and so that you understand the total person. So we've just talked about cognitive, social, behavioral, and humanistic learning theories.